enters the patient's lungs through the inspiratory limb of the ventilator circuit and exits through the expiratory limb. The ventilator's exhalation valve opens and closes to control the flow of gas into and out of the patient. Looking closer, we can see that the trach tube is sealed in the trachea by means of an inflatable cuff. Gas enters and exits the patient's lungs distal to the trach tube cuff, so the vocal cords are never in communication with the airflow. This makes speech impossible. The speaking mode option enables the patient to speak while on mechanical ventilation. It is selected from the ventilator's main screen by touching the button designated by the speaking mode icon under the yellow arrow. After touching the speaking mode icon, the trach tube cuff must be deflated before the next step of actually activating speaking mode. Once the cuff is deflated, simply follow the prompts on the screen to activate speaking mode. If the mode is activated before the cuff is deflated, V200 will automatically detect the failure to deflate, alarm, and continue normal ventilation. With speaking mode engaged and the cuff deflated, gas enters the patient's lungs through the inspiratory limb of the circuit during inspiration. However, during the exhalation phase, gas is not allowed to exit through the circuit and thus passes by the deflated cuff and up through the vocal cords. This enables the cords to vibrate and permits the patient to speak. Patients quickly learn how to coordinate their breathing to speak during the exhalation phase of mechanical ventilation. Speaking mode may be used in volume control, pressure control, or in assisted modes of ventilation, such as pressure support. For safety, the patient is always being monitored by the V200, and audible alarms will alert clinicians to any changes in the patient's ventilation.